During a delivery, the amniotic fluid appears greenish, brown, and smells foul. What should be your first priority in newborn care? Would it be A, immediately intubate and provide positive pressure ventilations? B, begin chest compressions followed by suctioning? C, dry warm the baby and suction the airway, stimulate for breathing? Or would it be D, use a meconium aspirator to deep suction the trachea regardless of activity? Now, I would agree with you 100% that there is information that is missing out of this test question, but let's be honest. How many times have you sat for a test where there was a lot of information that's missing? We don't know if this child's vigorous or non vigorous. We don't know if this kid's term or preterm. We don't even know their breathing status. We know nothing about this child other than there is meconium staining. Now, there is a couple things that I want to air out with regards to meconium stained newborns. First, the goal is to get this child to breathe, preferably not breathe when there's meconium inside of their mouth. So, if there's ever an opportunity to suction mouth and then nose, we will do so before we try to stimulate that child to breathe. If the child is non vigorous and not breathing, we do need to assist these ventilations. Back in the day, we used to do D, was a very common answer in a test question like this, but D is no longer really recommended unless we're unable to get that air into the child. So if we're unable to ventilate the kid, then we're going to have to do deep tracheal suctioning. The goal here, though, the first priority and the best answer is C, dry and warm the baby, suction out the airway, and then stimulate that child to breathe. This should be your first priority with a meconium stained child. Again, if that kid doesn't start breathing on their own, we need to assist these ventilations. But if the kid does start breathing after you suction and then dry, warm, and stimulate, then we would just monitor them. We no longer have to use meconium aspirators on every meconium stained child. So again, the answer here, C.